Okay, let's talk about causes of ulcer. Causes of ulcer. Yes, I have explained what ulcer is all about. Now, what do you think that can cause ulcer? Some people will say, I used to eat peppery food, especially when you see a patient and tell this patient you are having ulcer, they will tell you, I don't used to eat peppery food though, or because I have ulcer, I don't cook peppery food in my house again. Or pepper do not cause ulcer. Pepper doesn't cause ulcer. What are the causes of ulcer? Having said that, ulcer is of two types. The commonest cause of ulcer is a bacteria called Helicobacter pylori, in a short form H. pylori. Outside having the hereditary, outside having genetics, outside family history of peptic ulcer, bacteria that will cause ulcer is called Helicobacter pylori. It is a stubborn bacteria. But in this kind of ulcer, it is treatable. Note the difference between manageable and treatable. When you say this case is manageable, it means you can take it, you can have it for life. But when you say it is treatable, it means within a short time, you can now get rid of that particular problem. So when you have ulcer that is in relation with bacteria, it means you can treat it and you are free for life. But when that kind of ulcer is family related, then you will manage it and keep managing it, and each member of the family will definitely come down with ulcer because it runs in your lineage. So commonest causes or risk predisposing factors of peptic ulcer. Number one is stress. When you have stress, let us assume you are having issue with somebody, you are shouting, you are quarreling, there is this chemical that will be released in your system. Remember, in gastric ulcer, we have reduced secretion of hydrochloric acid. Then in duodenal ulcer, we have excessive secretion. When you are tense, when you are stressed, there will be reduction in your hydrochloric acid. All right, this reduction will cause irritation in your stomach lining, and that will give you ulcer. Stress is one of them. Anxiety will cause hypersecretion of this hydrochloric acid. For instance, you have issue, or maybe something happened and you are scared. At that point, you won't feel hungry because there is excessive secretion of hydrochloric acid. When this hydrochloric acid is released, it's going to be churning off your stomach lining, and that will leave you with peptic ulcer disease. Then smoking. If you are the type that smokes, trust me, you are leaving your system with a chemical that will predispose you to peptic ulcer disease. And we see that kind of disease in duodenal ulcer. You smoke, you drink alcohol. At a point when you are drinking alcohol, your system is now going to be mimicking alcohol in place of blood, and you are now exposing yourself to peptic ulcer disease. Another cause of peptic ulcer disease is anger. You are quick to angry. Yes, you are angry. Once you are angry, hydrochloric acid will be secreted in excess, and then ulcer will come in. Seasoned food. You don't joke with fast food. Every little thing, you have run to fast food. You are a big boy. You want to show them that you are a big boy. Then you will run to the fast food to eat. You are just exposing yourself to peptic ulcer disease. In these causes, I didn't mention pepper. Rather, I mentioned smoking, alcohol intake, stress, anxiety, seasoned food, hydrochloric, Helicobacter pylori. These are the things that will just give you peptic ulcer disease. And now, how are you going to manage it? I will stop here now and talk about management in the next video. See